afternoon.
Good afternoon.
It is really a pleasure to be here. It's a momentous day, as Fran said, and it's a day that has been too long in coming, right? And so, you know, as the mayor and I spoke about during my interview, this is a priority for me coming in. This is a priority for Mayor Rawlings-Blake, and this report, this blueprint comes at the perfect time. And so I would like to give my sincere thanks to the Commission for working with us and for getting this plan done. And as I've been talking to various media outlets today, it's a document that binds us. It puts us shoulder to shoulder in this ongoing struggle for HIV. You know, and I think that part of it, I share the outrage that Mayor Stephanie Rawlings-Blake expressed earlier. You know, it's like we're the richest state in the country, and it's time that we put those resources to the benefit of our community and to reducing this epidemic. And I think one particular stat that I find completely unacceptable is that in 2009, the latest year for which stats are available, 27% of the people newly diagnosed with HIV were already well on their way to having AIDS. That just shouldn't be. That just shouldn't be. And so we're all about action. We're all about setting goals. And that's, in addition to meeting the 25% reduction, we need to see a reduction in that number. And so it's a momentous day, and it's especially momentous because this plan is in sync with the National HIV/AIDS Prevention Strategy. And it's ushering in a new day, not just in Baltimore City, but across the country. And they are plans that clearly we all know emphasize reducing new infections, improving access to care and outcomes, and most especially in reducing disparities, racially based health disparities. And so, as was said, the National Prevention Strategy focuses on a 25% reduction. Healthy Baltimore focuses on a 25% reduction. And even though it's really ambitious, it's something that we can and we will get to. And so it's exciting to be a part of this team. And the way that we get to that is through active testing, outreach, and helping to improve access to care for those with HIV. And so one of the most important areas is really, as I mentioned earlier, focusing on reducing disparities. 87% of new HIV infections in Baltimore City are amongst African Americans in this city. And African Americans represent 64% of the city's total population. And so, as part of the strategy that was referenced, as one of what was referenced in the strategy, 44% of the city's population, 44% of the city population from 10 zip codes represents 60% of the HIV cases. So said differently, place matters. We talk about Healthy Baltimore 2015 emphasizes that where we live, work, learn, and play has as much to do with keeping us sick as it does and making us healthy. This is a glaring example of that, of how 60% of the new HIV cases are concentrated in 10 zip codes. And those are the same zip codes that have high STD rates, high poverty and crime, along with higher rates of other poverty-related health problems like cardiovascular disease and diabetes. And so we at the Health Department are working in concert with our partners at the state. We've got two great champions here with Fran and with Heather, and in the community in working to address these issues. We do a lot, and I'm just going to run through these stats, and you all know them better than I do. We've done over 45,000 HIV tests. We've identified several hundred people who have HIV who were previously unaware of their status. And we provide care through our STD clinics to those who have HIV and can't get services elsewhere. We're working collaboratively with partners here in the room and those that are not in the room. Specifically, we're working with MICA, the Maryland Institute College of Art, on a campaign to raise awareness and testing among amongst African American MSM, because as was stated earlier, that's what's driving our ongoing epidemic. And in bringing awareness to this issue, part of what we're trying to do is also reduce the stigma. We shouldn't keep people in the closet in 2011. It's just not where we want to be. And so our focus is to ensure that patients who test positive get into care early, stay in care, and partners are notified, and if those who are sharing needles, we get them into our needle sharing program, or a needle exchange program, sorry. And so through this plan, through Healthy Baltimore 2015, through what we've talked about today, what we are really saying is that in locking arm in arm, shoulder to shoulder, we have to hold each other mutually accountable for our success. There's no room for failure, but we have to hold each other accountable for mutual success. Part of another recommendation that came out through the Commission's report, which I am really very much behind, is the need for greater collaboration and alignment of resources. And so what I did when I first came into the health department was realign the services that we provide for HIV STD services and created a bureau for HIV STD services that brings together coordination of prevention dollars, how we work with our partners on treatment dollars, and how we implement our program on needle exchange. And I am really pleased to announce today that we have hired an assistant commissioner for this very important bureau. And I'd like to introduce Dr. Patrick Chalk as the new assistant commissioner. And that's getting Dr. Chalk on our team is a major score for not only the health department, but for the city. Dr. Chalk has a long history in Baltimore City and a long history in this state. And I'm proud to say that many, many years ago, I won't say how many, Dr. Chalk was actually a provider in our STD clinic. He has taught on courses on HIV/AIDS within our community and in our universities, and for the past 15 years, he's been a senior project officer with the Annie E. Casey Foundation. And so we are very excited to have Dr. Chalk and the experience that he brings with him to the table. It's another strong tool in our tool set for tackling this epidemic. And so it's with these remarks that I welcome this new chapter in addressing HIV/AIDS within Baltimore City. And I once again thank you, the commission members, our partners in the community for this hard work that you've done. And I welcome you in the ongoing struggle. And we will be there arm in arm, shoulder to shoulder. And so with that, I would like to thank again the commission and invite you all up and invite the previous speakers up for any questions that we may have from the media. Thank you.